In Uganda, thousands of women and girls face an invincible crisis every day. A crisis that begins in silence, shame, and fear. One night, one decision, and lives can change forever. Behind the statistics are real people, mothers and students, market women, navigating choices that could save or end their lives. This is the story of reproductive health, the challenges, and the fight for justice. Reproductive health is more than just medical care. It is the right to make informed decisions about one's body, the ability to prevent or plan pregnancies, access to family planning, safe childbirth, and post-abortion care. It is about dignity, choice, and safety, ensuring that women and girls can live full, healthy lives without fear or stigma.
Many people still lack information, both young and old. They lack information on the available services. Many people lack information on self-care, which is basically the kind of care that an individual can access, driven by themselves, but with support from the healthcare system.
In Uganda, progress has been made. Maternal deaths have fallen from 336 per 100,000 live births in 2016 to 189 in 2022. Clinics offer family planning and post-abortion care, and young people are beginning to access reproductive health education. Yet beneath these numbers, gaps remain. Unsafe abortions still claim lives. Stigma silences voices, and many women remain unaware of their rights.
Building on the fact that there are very many challenges in sexual reproductive health and rights. For example, we have a very high teenage pregnancy rate in Uganda, averaging around 25% for over 15 years. But when you look at the root causes of that high teenage pregnancy rate, it borders around lack of information on sexual reproductive health for these young people. There are challenges with access to post-abortion care services. There are many people who do not know that, for example, access to post-abortion care is their mandate or legal mandate, regardless of how the abortion happened.
Unsafe abortion is often performed in secrecy by untrained providers through dangerous methods at home. Women are driven by poverty, lack of education, unstable relationships, and pressure from family or community. Stigma and fear of punishment make them delay care, increasing the risk of complications and even death.
The reasons why these younger girls end up with the complications of unsafe abortions is that there could be fear from their parents. They fear probably the teachers, and they fear the authorities around them. And when they have got pregnant, they don't know whom to tell.
Omwana niwesanga nga afunye mukwano gwe pia munne omuntu bali mu category asobola omuwagamba omanyi teekayo ennanda nywa ku makaayi genda wali oguleyo obukerenda.
In Uganda, I think the latest data we have puts it at around 800 abortions per day. This includes both those that are induced, meaning intended, but also those that happen on their own, which we call spontaneous.
In most cases, we found those people, they have already started on it unsafely. Why unsafe? Because we know Uganda, they have never legalized the abortion. It's illegal to abort. So that's why people are doing unsafe abortion, and they are dying there silently.
The Ugandan government recognizes reproductive health as a right, but legal and systematic limitations persist. Abortion is permitted only to save a woman's life, while post-abortion care is legal, life-saving, and must be provided without judgment. Despite these knowledge gaps, weak enforcement and stigma often prevent women from accessing care.
A lot of women, both young and old, have not yet experienced the reproductive justice that they deserve. But for it to be realized, it needs that they themselves demand, okay? They demand these services, they demand the quality, they demand the ease in access, okay? Otherwise, it would be very difficult for them to realize what they ought to receive if they don't understand it and if they don't demand for it.
There is still that challenge in the facilities. They help with the fear. They think they will be arrested, but we are struggling to make it clear.
Fear to tell us, according to our laws of Uganda, people still do fear, but some of them, according to what I've exercised here, they have known something and they are ready to advise people accordingly.
With the help from IPAS and AOGU, we have been able to help mothers in such a category, and they have been able to reduce on that challenge of mothers getting complications from such things like abortions.
Post-abortion care is available from Health Center 3 upwards. It includes treatment of complications, counseling, and family planning services. But challenges remain. Some facilities lack supplies, health workers face cultural or religious pressure, and many women fear judgment. Bridging this gap between law, policy, and practice is crucial.
I advise those girls about abortion. Nemugamba, the choice is yours to make, but it's better you go to the facility, you talk with those community personnel, health personnel, health caregivers. They can manage you. You can talk to the doctor, midwives, rather than going to these other people. Abagenda okuleetera obulamu bwo mu matigga. Era abaana abo endinga apo nga bayambiddwa, abamu embuto bazikuza nosanga musawo na taking advice n'entandika nti neeto omwana wange mwina.
Naye abasawo bano we baavaayo ne bajja ne batutangaaza, kituyambye nnyo okubeera nga tumanyi ne ba youth bano okwongera okumanya nti ekintu ky'okugyamu olubuto tekikwetaagisa kukukuta, bw'oba oluggyemu kwata ekkubo, genda ku ddwaliro oba genda ku health center yonna ogenda funa obujjanjabi bulungi ddala okusingako wali eri nti kyalinga kyakukukuta.
Yes, abortion is not legal in the country, in Uganda today, but we have to ensure that there is post-abortion care. And in that way, IPAS has come through to give the right information to ensure that the public knows what to do and where to go in case they need this information.
Partners like IPAS Africa Alliance and the Association of Obstetricians and Gynaecologists of Uganda are stepping in. Their project in Kampala, Wakiso and Mukono trains youth champions, market women, media practitioners and health workers. Through workshops, outreach and advocacy, they are transforming knowledge into action.
It was essentially leveraging on the positive environment in the sexual reproductive health space in Uganda to increase agency of women and girls to be able to demand and access sexual reproductive health and rights services in Uganda.
There were trainings and talks about how to manage, just in case you get a UTI, what family planning methods you can opt for, options that are out there for young girls to avoid unwanted pregnancies.
Main focus of that was to allow us, especially who are working with the students, if we can get involved in the untold curriculum as it was told, and also maybe participate in teaching the untaught curriculum.
Young people at universities share knowledge responsibly, reducing stigma. Health workers and VHTs reach hundreds of women with life-saving care. This is the impact of knowledge, empowerment, and collective action.
I involved post-abortion care, and I encouraged the students as we went out to look for those mothers who also have undergone unsafe abortion, and if there is a way they could actually help them.
I'm happy that now my community knows what I'm doing, and they have taken notes that I'm not supporting abortion, but I'm helping those who are in need to get post-abortion care.
alanga nti bintu ebyeyinulwa abantu abakuze emyaka nga 5-6 oba 4 abakooye ba retired mothers abakyasobola kuzaala. Naye okuva lwe yajja, I learned how to speak up. Mpa health talks mu byalo n'ensomesa abaana ku masomero.
To deepen impact, recommendations include scaling professional-led trainings, strengthening collaborations between universities, media, and sustaining community dialogues to reduce stigma. With continued advocacy, Uganda can move closer to reproductive justice for all women and girls.
We should give opportunity to our girls to talk to us, and we can give room to help other than becoming so tough and we want to chase them from home and so on.
We have a lot of positive policies and guidelines in the space of sexual reproductive health and rights in Uganda, and each of us has a mandate to make sure that this information is known and available to every Ugandan, especially the women and girls, to see that we use this information to improve the sexual reproductive health rights services in the country. A lot of our information remains known to a few, and the users ultimately end up remaining the way they are.
Women and girls deserve the right to make choices about their reproductive rights. In Uganda, the journey towards reproductive justice is underway, but there is more work to be done. Together, knowledge, empowerment, and courage can change lives.